Hello, my dear students. So, in the series of 30 most important pharmacology topic for FMG Jan 2024 exam, so I have come here to discuss the topic number 3 with you, that is the treatment or the drugs which are given for hyperthyroidism. So, the disease hyperthyroidism is also known as Graves' disease, and during acute crisis, we also call it thyrotoxicosis or thyroid crisis. So, which medicines are useful for hyperthyroidism? So, we can divide these medicines grossly in three groups. So, we have total three group of medicines which we can use for hyperthyroidism. Medicines which are inhibitor of hormone synthesis. Medicines which are inhibitor of hormone synthesis in thyroid gland. So, these medicines act by inhibiting one enzyme. We call it thyroid peroxidase enzyme. So, medicines can inhibit thyroid hormone synthesis by inhibiting thyroid peroxidase enzyme in thyroid gland. Second class of medicines are those which are thyroid hormone release inhibitors, medicines which can inhibit the release of thyroid hormone from the thyroid gland. And the last is medicines which are known as peripheral conversion inhibitors, medicines which are known as peripheral conversion inhibitor. So peripheral conversion inhibitors are those medicines which can inhibit conversion of T4 to T3. So guys, you must be knowing from physiology that if I talk about this thyroid gland, so in this from this thyroid gland, thyroid hormone is mainly released in T4 form. After reaching the peripheral organ, this is converted to T3. So medicines will inhibit this conversion of T4 to T3, and the T3 is the one which is the final active form of the thyroid hormone that will act in the organ. Although T4 is also active, but the more active form is T3. So the final conversion of T4 to T3 is blocked by some medicines. We call them peripheral conversion inhibitors. Now, if we talk about these medicines, peripheral conversion inhibitors, these medicines are the fastest acting medicines. So among all these three groups, the fastest acting group is medicines which are inhibitor of the last step, that is peripheral conversion inhibitor. And all these medicines name you can remember with the letter, that is P. So P stands for peripheral conversion inhibitor. These medicines names are propyl thiouracil. So the medicine name is propyl thiouracil, which is overall considered as drug of choice for thyrotoxicosis. This is the best medicine for the treatment of thyrotoxicosis. Drug name is propyl thiouracil. Now the second medicine that belongs to this class is propranolol. So propranolol is a beta blocker. Now this medicine is also inhibitor of T4 to T3 conversion. It's a beta blocker. Third medicine is steroid. So we have a group of medicines, steroids, which are also inhibitor of this peripheral conversion. Just for the sake of mnemonic, we can remember the most commonly used steroid, that is prednisolone. So prednisolone is a drug that starts from alphabet P. So here we can say there are three medicines that start from alphabet P. They are inhibitor of P, that is peripheral conversion. And among all these medicines, propyl thiouracil is drug of choice for thyrotoxicosis. Now we can discuss medicines which are thyroid hormone release inhibitors. Now the medicines which are thyroid hormone release inhibitors, these medicines are the second fastest acting medicines in treatment of hyperthyroidism. So these medicines are also given for the treatment of thyrotoxicosis. So these medicines are also given for the treatment of thyrotoxicosis because they're the fastest acting medicines. So after giving peripheral conversion inhibitor like propyl thiouracil, if I have to add some second drug, I will add these medicines which are known as thyroid hormone release inhibitor, and the group is known as iodides. So medicines are known as iodides. So we have the medicines like sodium iodide, we have the medicines like potassium iodide, so NaI, sodium iodide, potassium iodide, and we have a medicine that is Lugol's iodine. So these three medicines are there, which are the second group of medicines which are added after peripheral conversion inhibitor in treatment of thyrotoxicosis. Now, guys, please remember these medicines are strictly contraindicated in pregnancy. They are highly teratogenic medicine, should not be given to pregnant females at all. Now, apart from that, we have a first group of medicines, one more group of medicines, we call them thyroid hormone synthesis inhibitor. So if we talk about medicines which are thyroid hormone synthesis inhibitor, we have two medicines that belong to this class. So we have a drug name is carbimazole. Now, carbimazole has a metabolite which can form in the body, that is known as methimazole. So methimazole is a metabolite of carbimazole. So carbimazole, methimazole, more or less the same drugs because this methimazole is a metabolite of carbimazole. Now we have a drug that is propyl thiouracil. So propyl thiouracil is a drug which has two mechanism of action. You can see from here, propyl thiouracil is hormone synthesis inhibitor, as well as this medicine is peripheral conversion inhibitor. Now carbimazole, methimazole are considered as drug of choice for maintenance treatment of Graves' disease. So they are the best medicines for maintenance treatment of Graves' disease. Best medicines for maintenance treatment of Graves' disease is carbimazole, methimazole, and we have discussed already propylthiouracil is the best medicine for thyrotoxicosis. That's an acute emergency in hyperthyroidism. Now, carbimazole is a drug which has a long half-life, but this medicine has a short half-life. Propylthiouracil has a short half-life. Carbimazole has a long half-life. Next point of difference, carbimazole is a drug that should not be given in patients of first trimester. So, first trimester pregnancy, this carbimazole is contraindicated, but propylthiouracil is safe to use in first trimester. And because it is safe to use in first trimester, it is a drug of choice for hyperthyroidism in first trimester of pregnancy. Now, why carbimazole is contraindicated? Because when given to pregnant female, this medicine can lead to one syndrome. We call it aplasia cutis. So, aplasia cutis, cutis means skin, aplasia means absent skin. So, baby is born with absent skin, most commonly over scalp region. So, baby is born with scalp defect. So, first trimester pregnancy, this is contraindicated, but propylthiouracil is a drug of choice for that condition. Now, if we talk about carbimazole further, this is a overall drug of choice in second and third trimester of pregnancy. In second and third trimester of pregnancy, this is not teratogenic, so this is drug of choice. But propylthiouracil is a medicine. This is contraindicated in second and third trimester of pregnancy because in second and third trimester, this medicine can result in fulminant hepatitis as a side effect. So this can result in fulminant hepatitis as a side effect. This is a contraindication of propylthiouracil. Now, apart from that, if we discuss the important side effect of carbimazole, carbimazole is a medicine which can result in agranulocytosis as a side effect. So, important side effect is agranulocytosis, and the important side effect of propylthiouracil is hepatotoxicity. So, this is all about the medicines which are given for hyperthyroidism. So, we have discussed one very important topic, that is hyperthyroidism. Now, in last of this video, we can discuss one bonus tip for you, medicines we can use for the treatment of thyrotoxicosis. So, whenever patient of thyrotoxicosis will come to you, so how will you treat the patient with thyrotoxicosis? So you start your treatment with propylthiouracil, which is overall a drug of choice, but this is started with beta blocker, that is propranolol. This is usually started with beta blocker, propranolol. So propranolol is a medicine. This is given not for its hypothyroidism property, but because to control the sympathetic symptoms. So we know that this propranolol is a beta blocker. This can control heart rate. This can control blood pressure. This can also control tremors. So all these sympathetic symptoms like CNS stimulation is there in hyperthyroidism. So propranolol is not useful for its hypothyroidism property as a main drug. This is mainly given to control the sympathetic symptom that is taking place in the patient body. So propranolol will provide fastest symptomatic relief. This medicine can provide fastest symptomatic relief, but propylthiouracil is a medicine which acts by two mechanisms. It is inhibitor of synthesis plus it is also inhibitor of thyroid T4 to T3 conversion, that is peripheral conversion. Now, if the thyrotoxicosis is not controlled by giving the above two medicines, we will add iodides to this group of medicines. Now, among iodides, we can add Lugol's iodine. So, Lugol's iodine are the medicines that we can add. Now, even then, this is not controlled. We have to add the third group of medicine. So, we can add the third group of medicines after iodides, that is steroids. So, steroid is a third group of medicine that we can add in the patient treatment. Number four, now in this patient of thyrotoxicosis, patient might be having hyperthermia. So patient body temperature may be high because of hyperthyroidism. Now for this hyperthermia, we can give the cool blanket to the patient, but we can also give paracetamol for the treatment of this hyperthermia. So treatment of hyperthermia, we can give paracetamol. Guys, please remember here aspirin is contraindicated. Aspirin is contraindicated, paracetamol is given for this hyperthermia. Number five, we can also use diltiazem. So diltiazem is a calcium channel blocker. This medicine can be given to control arrhythmia. Although arrhythmias are controlled by beta blockers also, but in case beta blockers are not able to control, in case beta blockers are not able to control arrhythmia, we can add diltiazem as an anti-arrhythmic drug, right? So this is all about the medicine that we use in stepwise manner for the treatment of thyrotoxicosis. Now here guys, you people have to give me one answer. First question you will have to answer me, propranolol belongs to which generation? You have to tell me propranolol is a beta blocker. This medicine belongs to which generation? And also you have to tell me what is the side effect of this generation of propranolol on bronchioles? What is the side effect of this medicine on bronchioles? This medicine belongs to which generation? And also you have to tell me what is the alternative of that. Like if a medicine will cause some problem in the bronchioles, what is the alternative that we can use instead of propranolol in case the medicine is causing the problem in these bronchioles? So with this question, you have to answer me all these questions, whatever I've asked in this video, in the comment box. And I'm ending up this video, and I request you to share this video with your friends and also subscribe to the channel. Thanks for watching this video.